Emotional dysregulation from a transdisciplinary perspective. Video by Paisley, Megan, Julia, and Dana.
Emotional dysregulation is the inability to regulate one's emotions, and when there is a deficit in the emotions an individual has or how they show their emotions. Individuals with emotional dysregulation lack the ability to display their emotions in an appropriate or socially acceptable manner for the context of the situation. Research suggests that emotional dysregulation emerges from a combination of temperamental and biological factors interacting with environment and life experiences.
Genetics and brain function are a key cause of emotional dysregulation. Serotonin within the brain is the source of how long and how intense an emotion can be within the brain. The idea that emotion regulation may be linked to this area is from recent evidence that patients with mood and anxiety disorders lack the serotonin bond within the brain. The amygdala is also linked to emotions and is able to react to particular stimuli that pose a threat, implicating fear and anxiety states. It has also been found that the ventromedial prefrontal cortex is also important for amygdala activity and emotional regulation. As discussed by Lauren and Powers, 2007, temperament is often measured based on emotionality. An example of this is negative affect. As discussed, temperament is also a biological trait that appears at a young age and can become more consistent over time in relation to psychological and physiological responses to emotions.
Children who are prone to a negative emotional affect or higher levels of emotional reactivity, who are also exposed to disruptive, chaotic, or stressful events or environments, will be at a higher risk for developing emotional dysregulation. These stressful events can include trauma and abuse, certain parenting styles, and negative attachment formations. Individuals who experience an abusive or neglectful childhood environment may not learn adaptive ways of coping with negative emotions. Prolonged and unpredictable stressful social environments are likely to affect a child's ability to learn internal mechanisms to regulate emotional states and can impact emotional and social development. Parents play a crucial role in the social and emotional development of children. Parents regulate children's skills and shape children's attainment of emotion regulation through parent-child interactions and relationships. Positive parenting is a protective factor against the development of maladaptive emotional regulation strategies. The function of the attachment system is to provide a sense of security in times of stress. When children are aware of the availability of attachment figures, it will result in a sense of security and appropriate emotional regulation strategies. However, people with insecure attachments have an inability to appropriately regulate emotional responses to stressful situations.
Emotional dysregulation presents in behavioral, psychological, and developmental disorders, including ADHD, bipolar disorder, borderline personality disorder, autism spectrum disorders, and psychopathology.
Based on research regarding the causes of emotional dysregulation, we have established an intervention involving a transdisciplinary team that can be used to address emotional dysregulation problems directly in any child regardless of any comorbid disorder.
The following video will display a case study involving a young boy named Josh, age 11, who is displaying many symptoms of emotional dysregulation while playing baseball. Please press play on the link below.